Today I will talk about a case study, homeopathic management of hydrocephalus. Age of the patient 7 years, gender female, condition congenital hydrocephalus. Total treatment duration was 12 months. Protocol used BrainMindia protocol. The child presented with classical signs of hydrocephalus, including noticeably enlarged head circumference, complaints of headache, irritability, and visual discomfort, delayed developmental milestones, and balance issues while walking, occasional emotional outbursts, poor sleep, and cognitive sluggishness. Her prior conventional care included neuroimaging follow-ups and supportive therapies. Surgery was advised but deferred. The family opted for a homeopathic and holistic approach under the BrainMindia protocol, focusing on neurodevelopmental support and intracranial pressure management. Now I will talk about homeopathic treatment plan through BrainMindia protocol. I had to administer 2 constitutional medicines. Number 1, Calcarea carbonicum 1m. It was 10m, Calcarea carbonicum 10m. This polycrest medicine was chosen for its deep-acting influence on developmental delays, bone growth, and systemic sluggishness. It was also addressed poor calcium metabolism, enlarged head, and chronic constitutional weakness. Besides Calcarea carbonicum, I had to prescribe Stramonium 200, which focused on calming neuropsychic overstimulation, fearfulness, and agitation linked to brain pressure, improved emotional regulation, and behavioral stability. As a therapeutic medicine, I used only one mother tincture, which was Actia spicata. This was used for muscle weakness, tremors, and discomfort from poor neurovascular coordination. It also helped with restoring strength and improving motor balance. Besides constitutional and therapeutic remedies, I had to use trituration medicines. There, I used 2 medicines, strychnine sulfuricum 3x and ammonium iodatum 3x. Strychnine sulfuricum 3x provided vital support for neuromuscular signaling and brainstem responsiveness. It also contributed to stimulation of sluggish reflexes and muscle tone improvement. Ammonium iodatum 3x, it was targeted lymphatic drainage, fluid absorption, and aided in managing intracranial fluid pressure. It also supported gradual reduction of cerebral congestion. Now, I will talk about treatment progress and timeline. In the initial phase after the completion of 5 months, decrease in headaches and irritability, improved sleep quality and social interactions, better response to visual and verbal cues. In the intermediate phase, between 6 to 8 months, notable reduction in head heaviness and better postural control. Milestone catch-up seen with fine motor and language development, increased alertness and curiosity reported by parents. And in the final phase, between 9 to 12 months, stabilization of head growth parameters, 60% improvement observed in neurological and functional domains, emotional calmness, and improved school participation. The final outcome summary was symptomatic relief received within 5 months with reduced irritability, headaches, improved sleep. Considerable improvement received by 8 months with better balance, alertness, and cognitive response. Treatment completed at 12 months with 70% functional improvement with family satisfaction. Parental feedback was, father said, "We were losing hope, but now she laughs, talks more, and even started reading small books." Practitioner's observation, child responded deeply to constitutional and brain drainage supportive remedies. So in conclusion, I can say this case reflects the integrative strength of the BrainMindia protocol in managing pediatric neurodevelopmental conditions like hydrocephalus through precise constitutional selection and organ-specific remedies. A holistic and non-invasive improvement in both symptoms and functions was achieved, avoiding surgical intervention and enhancing the child's quality of life. Thank you.